Pathology of the finger joints can affect a patient's range of motion, which in turn can have functional implications in activities of daily living. Begin with the patient seated comfortably. In most cases, approximating the patient's range of motion to normal values and comparing side to side is sufficient, and often collective movements are used rather than testing each joint individually. Start by having the patient straighten their fingers while keeping them together to test extension of the MCPs, PIPs, and DIPs. A patient should normally be able to completely straighten their fingers, and often small amounts of hyperextension are also normal. Next, have the patient spread their fingers wide apart to test abduction of the MCPs, which normally is 20 degrees, and then bring them back together to test adduction at the MCPs, which normally is full closure. Next, have the patient make a fist to test flexion at the MCPs, PIPs, and DIPs. A patient should normally be able to fully close their fist, fully burying their fingernails, meaning that they have approximately 90 to 100 degrees of flexion at each of the joints. Other screening movements to test include a lumbrical grip with flexion at the MCPs and extension at the PIPs and DIPs, as well as a hook grip with extension at the MCPs and flexion at the DIPs and PIPs. If the patient's active range of motion is limited in any of these movements, make sure to test their passive range of motion as well. With finger range of motion complete, we next move on to thumb range of motion.